Introduction. Intussusception might be a term for parents, but it's important to have some knowledge about this condition as it can affect young children. In this article, we will explain what intussusception is, its symptoms, causes, diagnosis, and treatment. This way, you'll be better equipped to recognize and address it if necessary. What is intussusception? Intussusception is a condition that primarily impacts infants and young kids. It occurs when one part of the intestine folds into itself like a telescope. This folding action can lead to complications, including bowel obstruction and reduced blood flow to the area. Symptoms. Recognizing the symptoms of intussusception is essential for intervention. Although not all children with intussusception will exhibit signs, common symptoms may include severe abdominal pain. Children may experience abdominal pain that comes and goes in waves, often described as colicky in nature. Vomiting. Persistent vomiting is a symptom, especially when it becomes bile-stained, which could indicate a bowel obstruction. Lethargy. Some children may show tiredness or irritability between episodes of pain. Blood in your child's stool may be observed in cases of intussusception. This is often described as having current appears. Sometimes you might be able to feel a lump or mass in your child's abdomen if they have intussusception. It is important to note that not all children with intussusception will display the range of symptoms. The condition can also be mistaken for issues like gastroenteritis. Causes. The exact cause of intussusception is often unknown. However, there are factors that may increase the risk. These include episodes of intussusception, the presence of a lead point, such as Meckel's diverticulum, recent bowel surgery, and interestingly enough, a history of rotavirus vaccination. Diagnosis. If you suspect that your child might have intussusception, it is crucial to seek attention. Diagnosis typically involves a combination of clinical evaluation. Your child's healthcare provider will conduct an examination which includes feeling the abdomen for any masses. Imaging. Ultrasound scans are commonly used as a preferred tool since they can confirm the presence of intussusception and help guide treatment decisions. X-rays. Sometimes doctors may choose to perform an X-ray, although it may not be as effective in diagnosing intussusception. Treatment. The main objective of treating intussusception is to restore the folded part of the intestine to its position. This is typically accomplished through a procedure known as a contrast gas enema. During this procedure, a gentle injection of liquid or gas is used to push the folded portion into place. In situations, surgery might be necessary if the initial attempt at restoration is unsuccessful or if complications like bowel perforation arise. Conclusion. Intussusception can be challenging to identify. Early detection and intervention are crucial for outcomes. As a parent, being knowledgeable about the symptoms and promptly seeking attention when needed can significantly impact your child's health. If you suspect your child might have intussusception or have concerns regarding their pain or bowel movements, don't hesitate to consult with a healthcare professional. Your attentiveness and proactive approach will ensure that your child receives care they require. Disclaimer. This article is intended for educational purposes only and should not be considered medical advice. Always consult with a healthcare provider for personalized recommendations.